Coronary artery disease. Coronary artery disease occurs when the coronary arteries are narrowed or blocked, reducing the amount of oxygen delivered to the heart. Two conditions, atherosclerosis and arteriosclerosis, commonly cause the narrowing or blockage of arteries. Atherosclerosis is a buildup of fatty deposits on the inner walls of arteries. This buildup causes a narrowing of the inner vessel diameter, restricting blood flow. Fats and other particles combine to form plaque. Arteriosclerosis is a stiffening or hardening of the artery wall resulting from calcium deposits. Often called hardening of the arteries, this condition causes the loss of elasticity, changing blood flow and increasing blood pressure.
The coronary arteries are small blood vessels that supply the heart muscle with oxygen and nutrients. Fat and cholesterol can build up inside these arteries, gradually clogging them. This buildup of plaque is referred to as atherosclerosis. When the coronary arteries become partially or totally blocked, the heart does not get enough blood. This condition is also called coronary artery disease. It can cause symptoms such as chest pain and shortness of breath. You may have mild, intermittent chest pain or more pronounced and steady pain. Hello, my name is Dr. Brian Foy, and I'm a cardiothoracic surgeon with Cardiac Surgery Associates. I'd like to take a few moments to explain coronary bypass surgery and what happens during this procedure. Normally considered a dangerous or scary surgery, the risk is actually lower than you may realize. The survival rate for coronary bypass surgery is 99%. My main message to you is that coronary bypass surgery is safer than you may have thought. Following surgery, there is minimal disruption to your life. You can determine your long-term health by choosing a healthier lifestyle. The coronary arteries are small blood vessels that supply the heart muscle with oxygen and nutrients. Fat and cholesterol can build up inside these arteries, gradually clogging them. This buildup of plaque is referred to as atherosclerosis. When the coronary arteries become partially or totally blocked, the heart does not get enough blood. This condition is also called coronary artery disease. It can cause symptoms such as chest pain and shortness of breath. You may have mild, intermittent chest pain or more pronounced and steady pain. Symptoms that usually bring a person to a doctor are a feeling of heaviness, tightness, pain, burning, pressure, or squeezing. This is usually behind the breastbone, but is also found in the arms, neck, or jaw. Several tests can be done to identify the cause of chest pain, such as blood tests, EKG, and angiograms. Sometimes coronary artery disease does not cause pain until the blood supply to the heart becomes critically low. The first symptom in this case may be a heart attack. In cases where there are no symptoms, a stress test may be performed. Coronary artery disease is sometimes suspected if there's a family history of heart disease and a combination of other factors including cigarette smoking, diabetes, high cholesterol, high blood pressure, and male gender. Coronary bypass surgery is recommended for disease of the left main coronary artery, disease of 3 or more vessels, cases in which medication or angioplasty hasn't worked. Coronary bypass surgery is a type of heart surgery also known as heart bypass surgery, coronary artery bypass graft, or CABG. The surgery reroutes blood around clogged coronary arteries to improve blood flow and oxygen to the heart. Increasing blood flow to the heart muscle can relieve chest pain and reduce the risk of heart attack. During coronary bypass surgery, the heart surgeon makes an incision in the middle of the chest and separates the breastbone to expose the heart and aorta. Surgeons will take a healthy blood vessel from another part of the body and make a detour around the blocked coronary artery. Depending upon how many coronary arteries are blocked, 1, 2, 3, or more coronary bypass grafts may be needed. The healthy vessels are collected from veins in the lower leg, arteries in the chest, or an artery from the wrist. Traditional cardiopulmonary bypass with a heart-lung machine is used for most coronary bypass graft operations. This machine adds oxygen to the blood and circulates blood during the surgery. This is necessary because the heart muscle must be stopped before the graft can begin. This requires other surgical staff members, which include a cardiac anesthesiologist, surgical nurses, and a perfusionist to run the heart-lung bypass machine. After surgery, the patient is moved to a hospital bed in the cardiac surgical intensive care unit for monitoring. Usually, within 12 to 24 hours, patients will be moved to a normal care unit. Patients usually stay in the hospital for 5 to 7 days and sometimes longer. After leaving the hospital, the patient is usually enrolled in a physician-supervised program of cardiac rehabilitation. This program helps the patient rebuild their strength through a monitored exercise regime designed specifically for bypass patients. It also helps to rebuild their confidence so they may return to a normal, active lifestyle. Most people will also return to work. The decision is usually based on the type of work and the level of physical exertion required. After surgery, it typically takes 2 to 4 weeks to start feeling better. The full benefits from the operation may not be determined until 3 to 6 months after surgery. Your doctor will help you determine the schedule for resuming normal activities. When considering the risks of CABG, it's important to remember that bypass surgery has been performed for more than 30 years. It is the most frequently performed major surgery in the United States. Our cardiovascular surgeons have received extensive training in bypass techniques. As with any surgery, your health before surgery is a major consideration in determining your risks. Health conditions that should be considered before surgery are age. Patients over 70 are at a slightly higher risk for complications. Gender. Women have a slightly higher risk. Having another serious medical condition such as diabetes, peripheral vascular disease, kidney disease, or lung disease. Previous heart surgery also puts a person at a higher risk. In most people who have heart bypass surgery, the grafts remain open and functioning for many years. Coronary bypass will improve blood flow to the heart, but not prevent the coronary blockage from returning. Lifestyle changes are necessary. Don't smoke. Eat a healthy diet, get regular exercise, treat high blood pressure and high cholesterol. If you're having symptoms, contact your doctor immediately. Your doctor may prescribe a diagnostic test to evaluate any symptoms and to monitor the progress of your condition. Preventive screenings can catch your arteries beginning to clog early, so you can make lifestyle changes that will reduce your risk of heart attack and stroke. Screenings are recommended for people who are not having symptoms. Edward Hospital offers a free online heart risk assessment screening. Simply log on to the Edward website, edward.org, and click on Be Heart Aware. It only takes 5 minutes. It's time well spent. Even though we can do wonders to fix your heart, prevention is still the best medicine. An ultra-fast heart scan is the safest and most accurate screening tool available for detecting the early buildup of calcium in the coronary arteries, the most common cause of heart disease. Nearly 20,000 patients have been scanned to date at Edward, and the patient satisfaction rating is consistently above 90%. Do yourself a favor. Do me a favor. If you have any of these risk factors, get tested. Early detection can save your life. Thank you.